Hello, welcome. My name is Megan Macklin. I serve as a program manager in the UC Davis Office of Diversity, Equity, and Inclusion, where I manage the Campus Community Book Project. Thank you so much, everyone, for joining us today. On behalf of the book project and our program partner, the UC Davis School of Medicine Alumni Week, we're so glad to have you. We're going to begin by going over a couple of housekeeping items for today's event. Today's event is featuring live captioning from Otter.ai live notes. To access a live transcription of today's event, locate the red Live on Otter live notes icon at the top left of your Zoom screen and select View Stream from the drop-down menu. You also can access the live stream by navigating to the link that's been put into chat. Today's event is being recorded. The recording will be made available on the Book Project website. To protect your privacy, you have the option to rename yourself as participant. This can be done by clicking the participant icon in Zoom, then select More next to your name to rename yourself. We ask that folks please keep themselves muted during the presentation. You are invited to ask questions in the chat during the presentation, also during the question and answer portion. Dr. Yellowlees has agreed to take questions throughout the presentation. We'll have a point during the presentation to take your questions. So please be thinking about things you may want to discuss throughout the presentation. We'll be happy to hear from you. And during our question and answer, you can also use the raise hand feature to ask your question. You can find the raise hand feature at the bottom of the participant menu. You also are welcome to go ahead and unmute yourself to ask your question. The UC Davis Campus Community Book Project promotes dialogue and builds community by encouraging diverse members of the campus and surrounding communities to read the same book and attend related events. The Book Project, a signature initiative out of the Office of Diversity, Equity, and Inclusion since 2002, advances the mission to improve both the campus climate and community relations, to foster diversity, and to promote equity and inclusiveness. Currently in its 19th year, the Book Project in 2020-2021 focuses on the theme of mental health and features graphic memoir Marbles, Mania, Depression, Michelangelo, and Me by Ellen Forney. Our theme and selection are supported by a year-long program of lectures, workshops, book discussions, film screenings, exhibits, performances, and more, which this year will take place virtually. Our program culminates when author Ellen Forney comes to UC Davis on Monday, March 1, 2021 to speak, hopefully in person, at the Mondavi Center for the Performing Arts. For more information about the Book Project program, visit our website where you can find up-to-date event information, registration links, and other resources. We also welcome your involvement, student, staff, faculty, and community members, in selecting the Book Project featured title and in planning our annual program. If you're interested in getting involved with the Book Project, please send us an email, or you can refer to the Book Project website for more information. And now, to introduce School of Medicine Alumni Week and our speaker, I'm going to turn things over to ML Farrell, Director of Alumni Engagement for the UC Davis School of Medicine.
Thanks so much, Megan. And I also want to welcome everyone who has joined us for this Zoom meeting tonight. And we have our alumni, students, and friends of UC Davis and the UC School of Medicine. And for our School of Medicine alumni, tonight is our second faculty forum, part of our Alumni Week 2020 virtual program. So I'm really grateful to the Campus Community Book Project for partnering with us to make this happen. So now I'm really pleased to introduce to you our speaker tonight, Dr. Peter Yellowlees. Dr. Yellowlees is the Chief Wellness Officer at UC Davis, and he holds the Alan Stoudemeyer Endowed Chair in Psychiatry at UC Davis. He has conducted research in the areas of psychiatry, telemedicine, teleinformatics, and physician health. And most of his research has been focused on how doctor-patient interface and how technologies can be used to promote high-quality patient-centered care and improve physician well-being. He's written over 250 academic papers and book chapters and 7 books, and was the author and presenter of over 180 Medscape Psychiatry Minute video editorials from 2009 to 2019. He's regularly featured in the media and has presented numerous invited lectures nationally and internationally, so we're extra happy to have him here. And I'm really pleased to have him share his wisdom, his experience, and his expertise with us tonight. Dr. Yellowlees, the screen is yours.
Okay, well, thank you very much indeed, ML. And I must say it's a real pleasure to be here, and I'm very honored to have been invited to give one of these talks. What I'm going to do is try and sort of mix and match between Ellen Forney and COVID, and we'll see how we go with that. But also to particularly think about some of the approaches that she used to manage her own mental health and how those can be helpful during COVID. Now, if I can just get this screen to move. There we are. Just 3 brief disclosures that are all relevant. I've written 3 books that I'll be taking content from for this talk. One on physician well-being, another on physician suicide, and the third on health technologies. But I want to, first of all, start with Ellen Forney and her really excellent book, which I have to say I've read all the way through myself and really enjoyed. But I learned quite a lot from it. It was interesting. She is clearly a sort of brave person, quite honestly. It's difficult to reveal to the world, you know, your own, how she describes it, dirty secrets. Coming out essentially as bipolar in what's a very graphic memoir at times, if for most of you who've read it. She shows a lot of the risks involved in that some people have when they are when they have a bipolar disorder. You know, in her case, interpersonal risks, sexual risk, physical risks, and substance use risks. I was really impressed by how she focused on her feelings, both drawn and written. And those feelings really were of fear, stigma, hopelessness, and struggles, not actually dissimilar from many of the feelings that people have in COVID as you try and work out what day of the week it is and whether you should be at work or not today. She actually had a very similar process to many patients that I've seen over the years in terms of coming to work out and really focus on her own bipolar disorder. You know, she went through phases of denial, of gradual insight, and then slow engagement with treatment, with multiple different approaches and attempts. And that's not at all uncommon. And again, I think mirrors to a certain extent the way we're managing to cope or otherwise with COVID. But she led ultimately to the ability to have a stable and balanced life. She really did conquer her illness, and she found balance. And one of the things that she used was a little sort of her own word, I guess, SMEDMERTS, which she said was really the key to her getting treatment and her surviving. And SMEDMERTS stands for sleep, meds, eat, doctor, mindfulness, exercise, routine, tools, support system. And I have to say, that's a really good prescription for surviving in COVID. And not everybody needs the meds, but most of the rest of the issues that she talks about there are actually really useful for people. And I think that she should be congratulated on that particular approach to her treatment. So let's look at what I'm going to talk about tonight, bearing in mind that the book project is about mental health this year. The first thing is to be aware of the main stressors related to COVID-19, to understand the emotional and physical reactions that we all have to stress, and particularly to isolation, which I think is increasingly being noticed nowadays. And by chance, for those of you who are in the health system, will have seen a message from me today in this week's Good Stuff about how to cope with isolation. Then I want to look at resilience and how we should all understand how important that is. And then I'm going to focus a little bit on healthcare workers and look at the particular coping mechanisms that healthcare workers employ and that we're actually using at UC Davis within our own health system to help people. Now, just to start off, this is a quote from Tony Fauci, who I'm sure everybody knows nowadays. If we had a massive pandemic tomorrow, all of us would be in serious trouble. The only difficulty is that he said this in 2008. And it's rather a tragedy, but in fact, things really haven't changed in the last 12 years. But there's no doubt that, as we all know, pandemics cause consequences. And in terms of, just to put our current pandemic in context, I actually wrote this slide probably about 2 weeks ago, when the deaths in the US were 215,000. They've now gone up by another 11 or 12,000. But if you look at the death rate from the coronavirus and compare it with other pandemics over the last 150 years in the US, you'll see that really was only one pandemic that is even close to being the same as this. And that's, of course, the 1918 influenza H1N1 pandemic, which killed, it's estimated, about 675,000 Americans and probably about 10 million people around the whole world. So thank goodness we're not there yet, but we've already dwarfed all of the other pandemics in the last 150 years. Now, what happens? What's the impact of a pandemic? And most of you will know this, but they're very widespread, and more widespread than many people wish to acknowledge. So apart from the obvious disruptions to daily living, the personal loss, particularly if you have someone who's died or been very unwell, there's the increased isolation and loneliness that people have, a loss of equilibrium, not just for individuals, but for communities and whole geographic regions. For universities, as an example, there's a real uncertainty as to how are we going to keep stable and keep moving forward. That comes on top of economic devastation, and then the ripple effects of multiple losses, particularly in the mental health area, where we've seen in the last 9 months increased rates of depression, anxiety, substance use, domestic violence, and suicide. Another area that I actually learned about today, where we've also had increased losses, have been increased rates of abortions in the last 9 months. So huge losses and ripple effects that affect all of us. Now, in fact, when a disaster occurs, it tends to occur in a fairly typical way, certainly from a psychological point of view. We tend to have a sort of pre-disaster phase, and then when the disaster strikes, we go into a sort of heroic period where people do amazing things, and the newspapers have great fun talking about all of the acts that have gone on. Then, unfortunately, we go into a trough. And we go through a period of disillusionment where we gradually come to terms with whatever's gone on, and we finally go into a period of reconstruction. And certainly, if you look at our current pandemic, we're in that disillusionment phase now. It just happens to be complicated by the fact that we may be also facing another phase of the pandemic. So we're at a sort of a combination of the disillusionment phase and also the pre-disaster feeling. So it's difficult, but we have very classical reactions to all of these situations. And in this disillusionment phase, it tends to last with most disasters, and these can be disasters from pandemics through to floods, through to fires, through to earthquakes, whatever disasters, wars. This disillusionment phase tends to be quite long-lasting, from just a couple of months to a couple of years. And it's characterized by feelings of disappointment, anger, bitterness, as the reality of the losses and the limits of the actual assistance become obvious. It's during this phase that the disaster agencies and volunteer groups pull out, and you see an example of that with Congress being unable to look at support packages at the moment, and people feeling, as a consequence, perfectly reasonably abandoned and resentful. It's also at this phase when there's a loss of the shared community that we often actually develop at the beginning of a disaster. And I think that's one of the things we really have to try and focus on to keep the community together and rebuild our individual lives as groups. So this disillusionment phase is fairly long lasting, and you can see from the sort of symptoms that there are how we're going through it at the moment. Now, what's actually happening from a mental health perspective? One of the best places to go for this is the CDC, and they have a weekly MMWR report, which, if you're really interested in COVID, is certainly the place to go to keep up to date with, on the whole, generally accurate statistics. This is an MMWR report on mental health from the middle of August, which in fact detailed the increased rates of depression, anxiety, and particularly substance abuse and domestic violence. Now, again, looking at how we cope during pandemics, there are very common reaction times, and I've covered some of these symptoms, but you can see the big difference between the early phase, which is sort of almost exciting. I mean, there's a sort of energy and an optimism and an altruism involved with that, compared with the later phases, which are clearly not exciting at all and are often frustrating, irritable, make us cynical. And I think you can see very clearly how many people are in that later phase at the moment. And if you just sort of talk to people, everybody admits at the moment to being irritable and just sort of fed up and frustrated and wanting to sort of move on somehow, but not sure how to do that. So what should you do? How do you respond to people when they're in this type of phase, or when they're having these sorts of symptoms? The first is to try and normalize people's reactions, to say, hey, this is actually normal. That's why I sent out a good stuff today on the topic of isolation, because it's a common problem, and our reactions to it are actually pretty normal. And by doing that, we validate and affirm our own emotional responses and help people understand what they're experiencing. There are a whole lot of coping strategies that I'll talk about in a few minutes. But at one level, perhaps the most single thing that's important that you can do is to actually help survivors do the things that they believe will be most helpful for them, and that will get them back to their pre-pandemic level of functioning. So when we're trying to help people, we're not trying to make them into sort of perfect human beings. We're just trying to get them back to the pre-pandemic level of functioning. So what this means is look for things that you can control. We know we can't control everything, but actually look around at a series of things that you can control, and then actually try and work on those particular topics. Don't try and do everything. Don't try and worry about everything. So sleep is a huge deal. We can generally control our sleep. And there are all sorts of ways of improving people's sleep hygiene. How you speak to yourself, how positive you are. Self-talk is good. There's nothing wrong with being positive and telling yourself that you're doing okay, and trying to be, fairly realistic about that. Who you follow, the boundaries that you set, in particular in COVID, what you eat. Baking's become one of the most popular national obsessions, and the consequence of that is increased weight. We really don't want people putting on weight. We want you to actually be exercising and controlling your body in a positive way. And we know that good physical health also equates with good mental health. And finally, you need to know when to ask for help, when things are really beyond you, and to try and go in that direction. But this whole issue of control is really important. And as I say, we can't control everything, but we can control a substantial number of things. So I'm going to stop and just ask if there's any questions at this stage. I've been covering the sort of background and the context almost of COVID, and I'll start to look at some of the more specific stressors going forward. I'm just trying to see if there's any questions.
Yeah, Peter, I'll ask. This is ML, and I'm wondering if you're looking at that, what you can control, and you feel out of control and want to sort of start with one thing, what might you recommend to focus on?
So I would personally focus on sleep, probably as number one. Make sure that your bed is comfortable, that you're getting to bed at a reasonably good hour, that you're not putting the television on all night, that you're not having too much alcohol before you go to bed, because that actually keeps you awake. You're settled. Maybe you might want to have some quiet music, or some people use meditation tapes, all sorts of things. But the most important thing about sleep is actually to set your alarm for the same time in the morning and get up at the same time. And if you keep on getting up at the same time, you don't have any naps during the day, and if you give yourself a chance of sleeping 7 or 8 hours at night, then you know, your actual body's natural rhythm will gradually take over, and you'll find your sleep will improve.
Terrific, thanks.
Okay, so if we just look, just shutting the chat room, sorry, at the different stressors among COVID, there's a large number of these, and these are stressors that we've talked to a lot of the nurses and physicians at the health system about in particular. And so you'll see that they have a sort of health worker sort of perspective to them. And in no particular sort of level of importance, you know, the stressors are, as you can see in front of you, this constant change, fear of transmission, changing policies, changing standards, changing news, changing information. You know, again, we don't know much about the coronavirus, and so it's not surprising that policies change. In the health system, a huge stressor has been anxiety about infecting families and infecting children, and taking something home from work that you don't want to, taking COVID home. For some people, it's actually been reduced work demands rather than increased work demands, and that's been stressful. Clearly, some separation and various other economic changes. So there's a lot of very, very specific stressors that are related to COVID. And I want you to think about how we respond to stresses, because we essentially have two different approaches to how we respond. And I'm just going to go back. We have emotional reactions to stress, which you can see in front of you here on the slide. And then we have physical reactions to stress that I'll talk about in just a second. So when you're talking about stress, think about both emotional and physical. So the emotional ones are everything from grief and loss through to loss of confidence, through to anxiety and fear. And, you know, they can be very dramatic. They can be very distressing. They can also be positive. They're not all necessarily negative. And sometimes people actually find that stress strengthens their spiritual beliefs, their social connectedness. Some people seem to thrive on stress and actually do emotionally better. But we also have physical reactions to stress, and there are lots of physiological reasons for that. And we get a whole lot of these, and you know, everything again from sort of muscle tension, increased blood pressure, heart rate, changes in our appetite, changes in our sexual interest. Some people get more headaches, nausea, and sleep again is one of the earliest things that tends to change with stress. So think about both psychological and physical reactions to stress as we go forward. Now, there are a whole lot of different approaches to self-care, and I've mentioned some of them already. Exercise is clearly one of the most important, as are things like yoga, Tai Chi, various mindfulness approaches I'll mention in a minute. Slow breathing using your diaphragm, a lot of cognitive strategies. There's some really good apps out there that you can use. I tend to use the apps from the VA. There was one called CBT-I, where the I stands for insomnia, CBT-I Coach. But there's Calm, there's Mindspace, there's a number of other, you know, really quite good apps out there. Obviously, I've talked a bit about sleep, but also hydration and nutrition. Eat well, drink a reasonable amount of water, keep active. I saw on the news today that sales of the board game Monopoly have gone through the roof in the last few weeks. As winter is coming on, people aren't going to be going out so much, particularly on the East Coast. They've all been going chasing board games because they're fed up playing video games and watching a TV. So look for interests and hobbies, and particularly interactive things that you can play with others, even if it is over Zoom or some other device. Then obviously balancing your work and particularly connecting. You know, we all know about social distancing. You know, in my view, it's a terrible term, and we will be much better to think of physical distancing and social connecting. And you know, you'll hear many people say that. So the bottom line is lots of different approaches to self-care. Think about the ones that work best for you. There is no best one approach. But equally importantly, don't do the wrong things. So avoid maladaptive coping strategies, such as working around the clock or not taking breaks, binging on alcohol or food, or just tending to be over negative or over generalizing. One of the maladaptive coping strategies is simply watching too much news. So actually you should restrict yourself to a certain amount of time that you feel comfortable with, and probably watch several different news channels. Don't just focus on one news channel the whole time. So meditation, and there are all sorts of different approaches to this. The beauty of meditation is that once you learn how to do it, you can actually do it in very rapidly. I use meditation techniques quite a lot, just in my normal work, and I can literally do sort of 1 or 2 minute mindfulness exercises in between patients if I want to just refocus myself, center myself, and get ready for the next person. So there's a whole lot of simple techniques that it's possible to learn quite easily. If you actually go on YouTube and you want to learn about mindfulness on YouTube, just put mindfulness into YouTube and you'll find lots of very, very nice, well set up videos. So what about self-care at work again? The key issue at work is to look after each other, to be aware of what the needs of your co-workers are, to check in with them, to try and use humor and breaks and timeouts, and to make sure that you're working as much as possible as a team. Again, there's no best way, but it's worth having a discussion about this and trying to sort of see if you can change the approach you use. Now people talk about resilience a lot. Really, resilience, all it is just the capacity to restore your normal function following a stress. Most people who work at a university like UC Davis are inherently very resilient people, because it's not easy to get a job in this sort of environment. The majority of people have got some professional background and training with degrees and various other achievements. And so by definition, most people have learned how to jump over quite high bars and have learned a lot of the resiliency tricks that we all need to know. So that's really what resilience is. It's just about this capacity to sort of get back to where you were before and to adapt in the face of a trauma. Now, this is a very nice one-pager, I guess, that Dr. Helen Cales from the Department of Psychiatry put together at the beginning of the pandemic as a sort of very rapid guide for wellness for any healthcare workers, but it applies to everybody at the university. Again, you'll see this on the slides and on the video if you want to go back and look at it in more detail. But essentially, what Dr. Cales did was just to look at the challenges for healthcare workers during the pandemic. Then she looked at the sorts of symptoms people get, looked at their basic needs, how they could stay healthy, how they could let other people help them, and keep positive. And she also has wanted to replace social distancing with physical distancing. And remember, in particular, in all of us in the education and healthcare worlds, that we're fulfilling a calling. So there's a good philosophical reason for us to keep ourselves well and to do our best at our jobs. And so this is, I think, a very nice, simple one-pager that essentially gives you a whole series of effective ways of coping during a difficult time. Now, I'm just going to stop there for a second and just see if there's any more questions. Don't see anything on the chat, so unless anybody wants to jump in, I'll give you all a second. Okay, well, I will carry on. So let's look at isolation. Isolation is a huge deal in the pandemic, and is actually more prevalent than it is after most disasters. If we look at figures that are pre-COVID, then we know that about a quarter of all seniors are anyway socially isolated, and about a third report being quite lonely. Now, we know that that's increased by at least 20% with COVID, and especially in the 28% of our population that live alone. So that's almost a third of our population living alone. We know that those people who are most at risk are those people who are also excessive victims of COVID. So the elderly, people of color, people who have low incomes, and those in restricted environments, such as nursing homes and prisons. We know that isolation is associated with increased death rates from chronic diseases, often because people don't look after themselves physically well if they're very isolated and lonely, as well as psychiatric disorders and suicide and substance abuse. So the isolation, in fact, is actually in the last few years been viewed as one of those social determinants of health, as a term that we use. Things like smoking and obesity that actually are sort of behavioral problems that lead to us having major physical problems. And we know that isolation is a risk factor for premature death, for instance, and that it can lead to cognitive decline, depression, anxiety, and impaired physical health. In the working population, which many of you are listening to this, we know that those people who are lonely and isolated tend to be less productive. Their work isn't such good quality, and they have increased absenteeism, or perhaps even presenteeism. These are very important. It's a very important issue, and obviously it's being made worse by the pandemic in a big way. Now, how do you respond to isolation? First of all, we need to understand that we are a social species. We have a biological need to socially reconnect. We can do that by many different ways: phone, video, other digital approaches. But I think equally importantly, we need to actually plan our days, even when we're not working. So plan our engagement, whether it's be with friends, errands, classes, interests, self-education, all sorts of things. But actually creating a schedule is a really good way of reducing that sense of loneliness and isolation. Staying physically active, particularly getting outside the house and connecting with people in a safe way, obviously at a distance and masked, but getting around the neighborhood, going cycling, playing golf, doing whatever it is you can do in a safe way. Pets are wonderful. I mean, I don't know how many people on the call have got a new pet, but statistically, there should be about 6 or 7 of you, looking at the number of 50 people who are here. It's probably more than that, in fact. But I know numerous people who've bought new dogs. And in fact, the press recently reported that there'd been a 13% increase in the sales of dog leashes in the last few months. Finally, if you are having real difficulty, don't be too proud. It's actually fine to accept help and to see a doctor, a psychologist, social services. All of these services are now essentially available to the home and are much more available than they used to be. So let's think about healthcare workers and how can they, in fact, look at looking after themselves? Because healthcare workers are a slightly different group. I mean, called essential workers, and a group that's at more risk in some respects of COVID, not just because they may potentially have to connect with people who have COVID and get the infection, but also because of the sort of moral injuries that a lot of healthcare workers are suffering at the moment. And by moral injury, I mean, they're looking at people who are partying and who are not looking after their community appropriately by not following CDC guidelines. And they're getting angry. and they're getting frustrated, and they're getting annoyed because in fact they know that this is going to increase the potential transmission of COVID, and that may lead to other patients having to come and see them and putting them at extra risk. So a whole series of reasons for these sort of moral injuries, but I think these are important issues for healthcare workers, and are things that are being fairly widely discussed in that group. Now, in the short term, I've been talking about a lot of individual coping strategies today, but in the long run, I think in a lot of healthcare systems, we've actually got to start changing practice to cope better in the long run. And that also clearly relates to the main educational and research practices on the main campus. Now, in the health system, we tend to think of changing well-being as being essentially involving 4 sets of solutions. The first is providing multiple different pathways for care. So anyone who's really stressed or distressed needs to be able to get hold of people to help them in many different ways, not just through your primary care physician, but through some self-assessment programs, through peer support, through coaching, through the employee assistance program. So a whole series of pathways to care so that people can actually receive appropriate treatment. Then we look at the culture, and we need to ultimately change our culture and move towards more of a culture of wellness. Now this applies across the whole university with shared values, behaviors, and leadership qualities that are really prioritizing personal and professional growth, as well as the community and compassion for others. I was reading a management book recently, and the author documented a lot of reasons why in a few years' time, the major single personality characteristic of a successful CEO would be empathy, which is an interesting approach. So certainly not financial characteristics at all. We're looking again in the health system about trying to make our practice more efficient. So changing the way we work, changing our systems, our practices, working more in teams, working with everybody at the sort of highest level of their licensing, and trying to essentially create more flexible work environments where people may be doing some more work at home, more work at flexible hours. And I think we're going to have to do this sort of thing right across the whole university and really start looking at the efficiency of our practices and not be sort of too sucked in by a lot of traditional inefficient practices. And finally, we look at the personal resilience side of things that I've been talking about a lot today. But I think we really have to start thinking about this culture of wellness and the efficiency of practice very broadly across the whole university and not just in the health system. So what have we done in the health system? We've been very assertive about messaging, about sending out information. This is good stuff that many of you will know. It actually goes out every single week in the health system to physicians, and it goes out to all staff about once a month. It was going out once a week for about a couple of months in the summer, and it may, if things go south again in terms of the COVID, it may start going out more frequently in the next few weeks. We'll have to see. But this is important messaging that is looking at giving people ideas, tips, hints, motivations for best practices in terms of looking after their own well-being. We are putting a lot of energy into peer support. This has actually been led by the nurses at the Med Center, by Michelle Lindenberger in particular, who's a nurse educator in the Children's Hospital. And over several years, Michelle has trained up at least 200 nurses to be peer supporters. We've now worked with her, and we're expanding that program significantly. And in the last 3 months, we've trained about 50 or so physicians to be peer supporters. We're also training pharmacists and people from the LIFT team, a number of people in administrative roles. And we're trying to train people essentially in what we call psychological first aid, which is really the skill to both listen to people when they're distressed and when things are not going well, and to, if necessary, refer them on to people who've got sort of deeper levels of skills. But the bottom line is trying to move to a culture where we all support each other and where it's normal to support each other, rather than, unfortunately, as many people have done in the past, tend to sort of show the other cheek. Technology is one of the answers, there's no doubt about that. This is my desk that I'm giving this talk from right now. It's at home, obviously. I don't possess a sort of old style computer that's wired in. Everything I have is wireless and is mobile. So I've got a laptop, I've got an iPad, I've got a phone. The big screen at the back is just a big screen I use so that I can throw pictures up on that if I want, but it's not attached to anything fixedly. And I think the whole move to mobile devices is making an enormous difference to the way we can deliver care. And we can clearly deliver care literally anytime, anywhere, and in many different ways. And I think we can do exactly the same with education and with many research projects. I've been running a research project for instance, for the last 5 years. We've now converted it to a fully virtual project with all the patients being seen online. And it's actually going a lot better than it was when we were doing it in person. There are a lot of advantages about using video. And incidentally, I'm not in the long run suggesting we should be only using technologies or video. I think we have to move to a hybrid process whereby we use video and other technologies for what they're best at, and we use in-person approaches for what that is best at. But I think we have to just assume that we're going to go in this direction more assertively than we might have planned in the past. And so the advantages for using video, certainly in patient care, are, in terms of time, cost, it's less tiring if you do it properly. You can have really good relationships with your patients across a variety of platforms. It's actually easier to do teamwork in this environment. And then there's the huge advantages of both geographic and scheduling flexibility. You can literally see patients from your home whenever you wish to see them or whenever they wish to be seen. So just coming to the end, I think in the healthcare world, we're lucky in some respects. This is a picture of what's called of ikigai, which is a Japanese approach to essentially being comfortable with your life. Certainly, I think in health and in the education and academic world, we're very fortunate. We all have a passion, which is the things that we love and which we're good at. We have a mission, again, things that we love, but things that the world needs in this time. We have a vocation, so the things that the world needs and things that you can be paid for, and a profession, and that's which is what we're good at and what we can be paid for. And if you can combine all of those things and think about those things and focus on them, then ultimately, you have overlap between all of them, and you reach the state of ikigai, which I think is a good way of thinking of the world. So this is Book Week. So going back to my last slide, I found on the internet that Ellen Forney, the author of our book, has actually been writing about the thesis that I started off with here, that her recommendations for bipolar disorder actually also prepared her for the COVID-19 pandemic. So you see Ellen Forney on the bottom right of the screen here. This is quite an interesting video that she was involved in, where she talked about her normal approaches to managing her bipolar disorder and how they've been helpful to her during COVID. So I am going to finish at that stage, and thank you very much indeed for listening. And I'm happy to take questions for as long as you wish.
Thanks so much, Dr. Yellowlees, for that very inspiring and insightful talk. I invite folks to think through some questions they may want to ask, you're welcome to put them into chat. Also welcome to raise your hand. I'm going to begin with a question that was posed in chat by Barbara. Thank you for putting that in. If you could please, Dr. Yellowlees, speak to caregiver stress. Many caregivers of young children and infirm adults are getting burned out because they lack respite owing to the fear of inviting others into their home.
Yes, I think both caregiver and the other question there and I see on chat is about children's reactions as well. I think a lot of the stresses are because people are literally trapped and caged up at home. And it's and that is the reality at one level. It's very difficult to avoid that. I mean, my suggestions are, as much as possible, to get out of the house and to give yourself some extra space, but obviously to do it safely. There's no doubt that, that the question is accurate. I mean, there are a number of caregivers that are getting burnt out, just like there are quite a number of, individual patients and individual people that are being burnt out. I know I get asked this question all the time by my patients. What can we do about it? And I can give them all the lists that that I've talked about with you tonight and all the different approaches and techniques. But what's most useful is just validating it with them and just saying, yeah, I get it. I understand. I actually have the same problems. It's a real pain. I can't work. I would love to know, which day of the week it is sometimes. I would love to know. I would love to be able to go and travel somewhere or see some extra people. I haven't seen my grandchildren for 9 months either. I think validating with people and just making sure that they know they're not alone actually does make a big difference and is a really helpful thing to do. And so that's, I guess, probably the most useful single thing that I do as a clinician. What about the children's reactions to COVID and school over Zoom and things? I think, again, it honestly depends on the age of the child and on the personality of a child to a great extent, as well as to the skills of the teacher and clearly any parenting skills that are being used, as a sort of quasi-teacher as well. So everybody's different. And so there isn't a sort of a catch-all answer to this one at all, I'm afraid. But again, I think validating what's going on, making sure that your kids can communicate with their friends in other ways, trying to have sort of carefully distanced sort of events if you can with small groups. I know that some people are sort of slightly enlarging their bubbles and maybe including some friends in those, but obviously you have to do that very carefully and be sure that the other people are being careful as well with their approaches to life. But I think the most important thing probably is actually to talk to children, ask them what they like, what works best, listen, try and be supportive of whatever suggestions they have that they think would be a good idea. And also spend more time interacting with them. That's why I think Monopoly is a great idea and other board games. Actually, have some fun with your children. Spend time doing other things that you wouldn't necessarily do, that are perhaps more passive, like just sort of watching a movie. And try and make any of their learning activities as interactive as you can. I'm just looking at the questions again. I can't see any other specific questions, but I have to say I agree with the term involuntary confinement in the home and the resentment that people feel when they're trapped. I mean, it's unfortunately that's very much how a lot of people feel, and it's getting more difficult as we get longer and longer into this without any particular good end in sight, and particularly with so many people breaking the sort of CDC guidelines, which is very frustrating for everyone, including me, I can promise you. Other questions or comments from anyone? So ML, you just asked me a private question and I'm going to publicize. How far down the trough do you think we are now? Well, I guess it's a matter of how you define the trough. I mean, my response to that in a non-partisan way is to tell everybody to vote. And I think that's the most important single thing. We know that advocacy is good for our well-being, and that trying to support community involvement, community engagement, there's actually quite good studies to show that's actually good for us. And so I think everybody should be voting, and they should be talking to their best friends and colleagues and making sure that they're voting as well. So that at least you can take some responsibility for whatever the results are in a week's time. And that's a crucial thing. I mean, that is one of the things we actually can do as individuals. ML, you're muted at the moment.
I know, I figured you could read my lips to just say thanks. And I was happy to have that question to everybody. But I will say, when you look at the disillusionment phase, it's like, how much more disillusioned will we get before we start climbing up? And do you think that sort of these layers of the things that are going on, racial injustice pieces of the puzzle, the election itself, all that is just sort of piling on, so that COVID is one piece, and how much more these other things are affecting us or layering on the stress that people are feeling?
But I think we've also got to take a long-term view, okay? And we will get through this. We're going to be fine. I mean, I was brought up in England in the post sort of Second World War era, when we all expected to have a nuclear bomb dropped on us. And we, in Britain, I can assure you, we just looked at both the US and Russia, who were having this horrible nuclear sort of fight, essentially. And we expected all the bombs to drop on Britain because we didn't think they were competent to actually hit the two correct countries. And so I actually was brought up in a house where we had gas masks in the cellar. We had food supplies in the cellar. Both my parents were out on walks and marches, and there were constant talks around the country constant, not talks, but I can remember vividly some children drawing the future, and they just drew these sort of black pictures, And let's face it, I don't think we're under a nuclear threat right now. Okay, now we may be, but I don't know about. But I mean, we'll get through this, okay? And other things have happened in the past, and you have to take that long-term view. Okay, any other questions from anyone? Yes, I like that. Keep calm and carry on. I think that's the British approach to life.
Peter, you shared your email. If people in the audience have questions, are you comfortable with people emailing you to say,
sure,
can you point me in the right direction?
Yes, no, absolutely. It's very easy to find. PM Yellowlees at ucdavis.edu. No, I'm always interested to get feedback and to interact with people. That's called socially connecting, right?
Exactly. Oh, I do have a question that maybe some of our alums will be thinking about in relation to our medical students and what they're dealing with in terms of trying to become trained as great physicians in this atmosphere. You have thoughts about that?
Yeah, it's really hard. So medical students, I mean, I'm sort of supervising one student at the moment who's doing an elective with me. And she, has the same problems that we've all got. She's having to be very careful about when does she go in and what patients can she see. She's clearly not able to see as many patients as she would normally have done. I think it's frustrating for them. They feel like they're not getting perhaps as full a training as they would have done normally. And I think that's probably the case in some situations, unfortunately. I think the school is doing an amazing job trying to give the students as good an opportunity as possible. But the reality is there have been some places that just refuse to take students at the moment. So the students have had to sort of get sort of new rotations sort of set up on the fly. And, you know, they're in the same position as many of the students on campus, you know, who are missing out on their normal classes, missing out certainly on their social interactions and a lot of the sort of fun and growing up component of being at college. And you can't get that back. It's a loss. And, you know, I think people are going to look back on COVID and, you know, almost say, well, what did we do during COVID and what was happening around then? You know, it's going to be one of those markers of our lives as we go forward, just like, you know, some of the wars have been for certain people. And this has actually affected, in some respects, you know, more people personally than many of the wars have done.
We have about 2 minutes left if we have any last questions. I like to say at this point, you know, if we were in person, we'd be smiling politely at each other. But unfortunately, we don't have that luxury of seeing each other's faces.
So I'm going to make a last comment, if you don't mind. I mean, I think the message to take away from tonight is that, you know, as humans, we will survive this. There are lots of approaches that we can use to cope and to move forward. The pandemic will not be with us forever. But in fact, at one level, I think it's a message to us. And to me, the message I see in it, that and the area that we've really got to focus on going forward is actually climate change. We know that a lot of the reasons for the pandemic are climate change related, and that some of the impacts of climate change are to make animals and humans live closer together, and thereby increase the chances of spread of disease from one to the other. And we know that that's the likely thing that happened with the coronavirus. And so to me, the real message about the pandemic is that we actually have to focus, you know, strongly in the next, you know, 50 years or so, at least, on climate change. And that's actually the area we should be really thinking about as we go forward.
Thank you so much. So we're at 5 o'clock, so I am going to officially end our session. I want to thank everyone for joining us. Thank you so much, Dr. Yellowlees, for your presentation, for engaging us in conversation. Folks know that we will have the book project recording, or the event recording, available on the book project website. But there we invite you also to check out our calendar of events. We have events all the way through the end of March this year, focusing on our mental health theme. So again, thank you so much, everyone. And we look forward to seeing you at a future book project event. Bye-bye.
Thank you.